Well, the other day, Dr. Ackerman stopped by to talk about something on a more serious note, and he talked about myths surrounding lung cancer. Take a listen. Lung cancer is the second most common cancer in both men and women, and it is estimated that more than 224,000 new cases will be diagnosed this year. When a disease is that prevalent, confusion and misinformation can often exist. So we're going to ask our expert to clear up some myths about lung cancer. And joining us now is Dr. Scot Ackerman, one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. Dr. Ackerman, thanks for being here.
Thank you, Casey. It's good to see you today.
So let's dive into some of these myths, starting with myth 1. If you've smoked for years, the damage is already done. Have you heard that a lot in your practice?
A lot of times, a lot of patients say, well, you know, I've been smoking all these years. It's not worth quitting. Well, the truth is it is worth quitting. It's never too late to quit smoking. Immediately, in the first year, the second year, your lungs get back a lot of their function. Almost all their function comes back. 10 years after quitting, the risk of lung cancer is cut by more than 50%, and it's about equal to someone who's never smoked in their life.
Wow.
But let me back up a little bit. Immediately, when you stop smoking immediately, in the first few months, your lungs clear out, you get better respiration, and your chance of getting cancer starts to go down very drastically, even just the first 2 years. But it takes up to 10 years before it equilibrates to what it would be for someone who's never smoked. And the immediate benefits when you stop smoking are improved circulation, increased lung function, you'll feel better in life. So it's never too late to quit.
Right.
And the longer you abstain from cigarettes, the better you feel and the lower your chance of getting lung cancer.
Okay, let's do another myth. Pipes and cigars are safer than cigarettes.
Well, the truth is that they can be just as harmful as cigarettes. The use of pipes and cigars not only increases your risk of lung cancer, which it does, but also because the cigar is in your mouth for a long time and the tobacco's there. There's a very high incidence of mouth cancer, throat cancer, gum cancer with cigar smoking and with pipe smoking as well. So, and cigars and pipes generally, when people smoke them, there's a lot more tobacco in them. A cigar is bigger than a cigarette, so one cigar is the equivalent of more than one cigarette.
Oh, so theoretically it could be even worse.
It could be. Many cigar smokers, however, don't inhale the smoke, but the smoke is still in their mouth, and that will increase their risk of mouth cancer and
Well, and they're
throat
still in
cancer.
the room, especially if you're in a smoking room or something and you have a cigar, you're going to inhale some of the smoke. It's going to be virtually impossible not to, I would
Right,
assume.
and also anyone you're with is going to be exposed to secondhand smoke as
Sure.
well.
Let's talk about myth number 3. Smoking is your only risk for lung cancer.
Well, that's not true either. It's the leading cause of lung cancer. It's the leading risk factor associated with lung cancer. But there's many non-smokers who get lung cancer as well, and we're seeing more and more. You know, the incidence of smoking, the prevalence rather of smoking, is going down. Thank goodness. Lung cancer incidence is still high, but because less people are smoking, we're seeing more and more lung cancers that are non-smoking related. We're seeing a lot of people that have been exposed to secondhand smoke. They have incidence of lung cancer. Also, radon gas is a well-known carcinogenic, and I encourage people that if they're in an area where there's radon in the soil to get their house checked. It's very easy and inexpensive to do. I think you can get it at one of the home stores.
Sure.
A thing to check your radon gas. You send it out because radon gas in the home can lead to lung cancer. Air pollution. Workplace toxins are related to lung cancer, and believe it or not, the human papillomavirus that we've talked about before for cervical cancer, we also see it associated now with a lot more people with cancer of the throat and head and neck cancer like Michael Douglas. That this HPV virus, the human papillomavirus, has also been implicated in lung cancer.
Okay, another myth we wanted to talk about, there is no screening test to detect lung cancer.
Well, in fact, there is now. We used to think that there was no good screening test. We tried all sorts of things over the years, chest x-rays, CAT scans, those sort of things. But now we have found new research that shows that low-dose spiral CT scans in patients that are at risk for lung cancer, I'll define that in a second, that using that on an annual basis can diagnose lung cancer earlier and cure more people with lung cancer. So it's a large trial called the National Lung Cancer Screening Trial. And what they looked at were people that were at high risk of lung cancer. Those who had a 30-pack year history of smoking. A pack year is 1 pack of cigarettes every day for a year. So if you smoke 2 packs a day for 15 years, that's a 30-pack year history.
Okay.
You smoke 3 packs a day for 10 years, that's a 30-pack history, or 1 pack a day for 30 years. So people that are otherwise in good health between the ages of 55 and 74 were looked at who had a 30-pack year history, and they found out that those that had the spiral CT, this is a low dose, meaning it's a special protocol where very little radiation is used in the CAT scan. In these people, we found lung cancers early and were able to cure them because we diagnosed them early. And so just this past week, or this week, this has been approved by the Committee for Medicare and Medicaid Services, CMS, to be as a covered item for patients in Medicare. And I'm sure that will be followed up with insurance coverage by private insurance as well.
Which is a good thing. Well, thank you so much, Dr. Ackerman. We appreciate you as always for the information, and thanks for coming on and sponsoring this segment. And if you have any questions for Dr. Ackerman regarding this topic or anything else that you might have, you can visit Dr. Ackerman's Facebook page, which is facebook.com/Ackerman Cancer Center.